Welcome back. Today we're looking at abdominal aortic aneurysms. Dr. Jason Roberts with First Coast Cardiovascular is here to tell us more. Abdominal aortic aneurysms, doctor. So that's a mouthful, but we're supposed to call it AAA? Is that what it goes by?
It's easier to call it a AAA.
Okay, a AAA. What is a AAA?
Even like you said earlier, it's a pretty prevalent disease, and even you had a friend who actually had it too.
Yeah, she did. It was actually my mom's friend, and she was in her 80s and smoked all her life, never had a problem with lung disease, but she did have vascular problems from smoking.
Yeah. And that's typically what happens. So basically what it is, it's just a bulging or, a weakening of the main artery that brings blood to the legs and the abdomen. So basically what happens, this artery either becomes hard or weakened and starts to bulge, as you can see in this picture here. And this is a pretty dramatic picture. The person on the right, that big bulge, that's actually their stomach, and that's actually the vessel bulging out of the stomach.
I'm looking at that going, are you kidding me?
Yeah,
that's a blood vessel?
It's definitely pretty dramatic. So, and these are one of the typical things that you see how patients present. That's a little dramatic, though.
Yeah, well, I mean, I guess they can get that big, but oftentimes I would think before they would get to be that size, they may rupture or burst. But
yeah, and that's definitely a problem. I mean, we try to catch them before that happens. Okay. So we won't talk about that yet.
No, not yet. That's
so we won't talk about that.
Got to put my glasses on because we've got specific instructions to follow certain slides here. Okay, now what are some of the risk factors of AAA? And we have
family history is going to be the first one. If it's in your family, you need to be checked. It's that simple. Smoking, high blood pressure, if you already have coronary artery disease, peripheral arterial disease, diabetes is sprinkled in there as well. But some of the major is family history, high blood pressure, and smoking. Those three, and then those combination of three can be an issue. And there's also some connective tissue issues such as Marfan syndrome. And Abe Lincoln had it. President Lincoln actually had Marfan syndrome as well.
Really?
And yeah, it causes.
What is that?
It's a connective tissue issue and it actually affects the arteries and causes them to be weakened and bulge. So people with Marfan's, if there's an audience out there that has Marfan syndrome, this is something they need to think about as well.
I've never heard of that.
A lot of people have it.
No. Okay. Let's talk about who is at risk for getting this disease in terms of gender specific here.
Men are 4 times more likely to have this versus women. So anybody over the age of 60, men or women, as you can see on this slide. And one of the points I want to point out on this slide here is that people who have had a bypass surgery, coronary artery bypass, are at a 9% increased risk. We believe that 9% of that population actually has undiagnosed aneurysms in their abdomen.
Really?
Yeah.
Because oftentimes you can have an aneurysm and not have any symptoms or signs until you're in a real serious issue.
Right.
And now when you talk about abdominal aneurysms, I've heard of brain aneurysms, but these abdominal aneurysms are actually in the stomach, and the arteries in the stomach, and oftentimes they can cause problems, at least with the situation the lady I knew, that it was causing problems with her walking.
Yeah, absolutely, and that's one of the big issues. You can have them anywhere. You can have them in the brain, any artery in the body. But we're going to talk about the abdomen today. But yeah, you can have a problem with walking, and I think the slide's going to come up. You can actually have pain in your back that radiates down your thighs. It's a pulsatile pain or a radiating pain. You can also have pain when you walk.
Now, when it pulses, let me just interrupt here for just a second. When it's pulsing, is that like with your heartbeat? Because you
can feel it. You'll have a back problem. You'll actually have a back pain, a pulsating back pain.
Okay.
And a lot of people just write it off and say, oh, I got chronic back pain, something like that. And it could actually be the aneurysm, because what happens is as the aneurysm bulges and gets enlarged and it sits on your spine and actually pulsates on top of that spine right there because of the heartbeat. So as the heart beats, it actually pulses on there, and you can feel that.
Okay. And who should get tested, and where should they go?
Anybody that's doing their Welcome to Medicare paperwork when they see their primary care physicians, as you can see on this slide, they can send you for a free one-time screening along with this paperwork. And those individuals that have any history of smoking or family history automatically receive it. So if you're 65, you're going in for your Welcome to Medicare paperwork, definitely consider asking your primary care about this. If you ever had a family history of it, or if you've ever smoked, you definitely want to.
And any limit on, so say somebody has actually smoked and then has stopped smoking, and they've been smoke-free for 10 or 15 years.
Still do it. Anytime you've ever smoked, the damage is done.
It doesn't self-correct?
It doesn't. We want it to self-correct. Maybe one day it will.
Okay. Talk about how AAAs abdominal aortic aneurysms are treated?
Now it's a lot nicer now than it used to be. Historically, they used to cut your stomach open and do this big involved surgery. Nowadays, we basically do it by putting a small little hole in each side of your groin, running a wire up, and we actually use stent technology and ballooning and things of that nature to actually seal the aneurysm, like you see here. You can see the little pair of pants on the right. That's what the stent looks like, and that's a covered stent. And what we do is we place it inside of the aneurysm. We deploy that stent, and it seals it off. And we'll have a couple of pictures of what it looks like coming up here in a minute,
okay.
What it looks like pre and post. And here they are. And this is a CTA. This is a really good picture. The picture on the left there, you can see that nice big bulge. And then the picture on the right, you can see that it's gone, but you see that white, those pant-looking things that we were just talking about.
Wow.
So basically what happens is we sealed that aneurysm with that stent.
And that stent actually seals it. It goes in there, and how does that?
We just seal it right off. It goes above it and below it, and basically seals it off. And we create a new channel of blood through the aorta, so it doesn't keep that enlargement of that aneurysm going.
Okay. All right. Listen, thank you so much for coming in. Some
very
valuable advice. And we can always. Should we go to our regular physician first, or can we call?
You can always call, or you can go on firstcoastcardio.com. We have plenty of patient resources there. I would definitely start with your primary care physician, or if you do see a specialist, you can start there as well. Whoever you're going to see first, and if you think you fit the model of any of these, I would definitely start there. Or if if there's a screening going on in town, and you see the screening and they do it for aneurysms, you can always go there as well.
Okay. Dr. Jason Roberts,
Thank you.
First Coast Cardiovascular, thanks for coming in.
Thank you.
All right.